Blepharoplasty or eyelid lift is one of the more common procedures we perform here at Ogilvie Plastic Surgery. And so I thought we'd spend a little time kind of discussing some of the questions that we get and kind of the surgery itself. So we'll talk about eyelid lift in kind of two parts, the upper eyelid and the lower eyelid. But in general, the most common complaint patients have is that they look more tired than they actually feel. So when it comes to the upper eyelid, there are really four major components to eyelid aging. So the first is when the brow kind of drops down, and this creates the illusion that you have extra skin of the upper eyelid. You can actually have extra skin of the upper eyelid as well. Sometimes we'll get a little bit of fat pooching and fullness in the upper eyelid, which causes kind of puffiness of the upper eyelid. And then in our older patients, what we can sometimes get is that the muscle of the eyelid either thins out or becomes detached from the anchoring structures of the eyelid, which causes the eyelid to actually drop down over the eyeball in a lower position, which is called ptosis. And so when we're looking to rejuvenate the upper eyelid, we look at all of these components and look to correct each and every one. So if someone does have a little bit of brow descent, we will look to do either a brow pexy or a brow lift to get that brow back into anatomic position. If you have some extra skin of the eyelid, we will remove that as well. Through that incision, we can remove a little bit of fat from the various fat pads of the eye to kind of give that smoother transition. And then lastly, if you do have eyelid ptosis, we do look to repair that at the same time. Now, when it comes to the lower eyelid, I think there are also four major components that create, eyelid aging as well. So the lower eyelid can become loose or elongated, and this can cause what we call the lateral canthus to drop down. You can have extra skin of the lower eyelid, which we call crepey skin. You can have some fat pooching through the lower eyelid, which creates that puffiness that a lot of people don't like. And then of course, as we age, we get a little bit of volume loss in the cheek, as well as the cheek will descend, which creates that noticeable difference between what we call the lid-cheek junction. And so patients will develop a line here, which is called the tear trough or the nasojugal groove. And so again, when we're looking to rejuvenate the lower eyelid, we look at all of the components of aging and try and correct them. So if you have a little bit of a looser eyelid, we will do what's called a canthopexy or a canthoplasty to tighten that area. Through an incision on the inside, we can remove some of the various fat pads to give you a nice smooth lower eyelid. If there is a little bit of extra skin, we remove that at the same time. And then lastly, if there is that loss of volume or cheek descent, sometimes we can do a little bit of fat grafting into this area to kind of smooth that transition out very nicely. So many of the times we are doing these in combination, and so I often like to do these under general anesthesia. However, if we are doing just upper eyelids, then they can be done under local anesthesia as well. Surgery itself takes about an hour and a half or so. It is an outpatient procedure, so patients do go home the same day. During recovery, I ask you just to ice your eyes pretty regularly for the first couple of days just to help with the bruising and swelling. You do have some permanent stitches that will come out at about a week's time. For the first few days, if you're doing some heavy reading or heavy, computer work, I ask you to kind of rest your eyes for an hour after that. And then I don't allow any, heavy lifting or heavy physical activity for about a month, just to give your eyes that chance to kind of rest and recover. But otherwise, recovery is pretty straightforward. Obviously, depending upon the age in which you do this, many patients don't have to do revisionary surgeries, as these results tend to last a lifetime. So here are some examples that we like to kind of go over and discuss with you as well.
This is a patient in her 50s who had extra skin and fat of the upper and lower eyelids, as well as a downturning lateral canthus, who underwent upper and lower blepharoplasty, as well as bilateral lateral canthopexy. This is a patient in her 60s who did not like the heaviness of her upper eyelids, who underwent a upper blepharoplasty only. This is a patient in her 70s who had unilateral brow ptosis, heaviness and excess skin of the upper eyelids, as well as fat pooching and excess skin of the lower eyelids, and loss of volume in her cheeks, who underwent bilateral browpexy, bilateral upper and lower blepharoplasty, as well as fat grafting to the cheek area. This is a patient in his 80s who had extra skin of the upper eyelids, along with pronounced upper eyelid ptosis and excess skin of the lower eyelids, as well as a downturning lateral canthus, who underwent bilateral upper and lower skin-only blepharoplasty with ptosis repair and bilateral lateral canthopexy as well.
So if you have been thinking about a blepharoplasty or have questions and concerns about, your potential options, please give us a call here at Ogilvie Plastic Surgery. We would love to see you in consultation and talk to you about some eyelid rejuvenation.